Plantar heel pain is one of the most common foot complaints affecting millions of adults each year. While plantar fasciopathy is often discussed, another significant cause is heel fat pad syndrome or HFPS. The heel fat pad acts as a natural cushion, absorbing shock and distributing force as we walk. When this pad is compromised, it can lead to pain and discomfort, especially during activities that put pressure on the heel. Despite its importance, HFPS remains under-researched and is often confused with other causes of heel pain. This confusion can make diagnosis and treatment challenging. In this video, we'll explore what current research reveals about HFPS, its prevalence, how it differs from other heel pain conditions, and what conservative treatments are available. Let's start by understanding just how common this condition is and why it deserves more attention. Research shows that HFPS may be the second leading cause of plantar heel pain, just after plantar fasciopathy. In a large US-based study, about 4.2% of older adults experienced pain and tenderness in the heel fat pad, while 6.9% had plantar fascia pain. Another study from South Korea found that 15% of patients with plantar heel pain were diagnosed with HFPS. However, many studies fail to distinguish between HFPS and other types of heel pain, leading to confusion in both research and clinical practice. Diagnosing HFPS involves looking for specific pain patterns, such as worsening pain after standing or walking barefoot, and using imaging like ultrasound to measure heel pad thickness. Yet there's still no universally accepted diagnostic standard, making it difficult to compare studies or develop targeted treatment. This lack of clarity highlights the need for more rigorous research and better diagnostic criteria. When it comes to managing HFPS, most recommendations focus on conservative non-surgical approaches. These include rest, activity modification, icing, tapping, and the use of viscoelastic heel cups. However, the evidence supporting these treatments is surprisingly limited. The review found only 2 intervention studies, one case report using silicone gel heel cups and a small quasi-experimental study on tapping techniques. Both showed some pain relief, but neither was a randomized controlled trial, which is the gold standard for clinical research. This means that despite being a common recommendation, there's little high-quality evidence to confirm what really works for HFPS. The lack of robust studies leaves both patients and clinicians with uncertainty. As we look to the future, it's clear that more rigorous research is needed to develop effective evidence-based treatments for this often overlooked condition. Summary: heel fat pad syndrome is a distinct and potentially common cause of plantar heel pain, yet it remains underrecognized and under-researched. The current literature highlights a significant knowledge gap, especially regarding diagnosis and effective conservative management. Many studies fail to distinguish HFPS from other heel pain conditions, and there is a glaring lack of high-quality clinical trials to guide treatment. For patients, this means that recommendations are often based on anecdotal evidence rather than solid science. For clinicians and researchers, it's a call to action to design better studies and develop clear diagnostic criteria. By improving our understanding of HFPS, we can hope to provide better care and outcomes for those suffering from this challenging condition.